Which of the following is an appropriate recommendation for initial management of this patient's condition? 21-year-old runner presents to sports medicine clinic with medial tibial stress syndrome. She's been experiencing pain in her lower legs the past month, worsens with activity. Physician recommends conservative management. Okay. I mean, conservative management for a sports thing. I'm thinking applying ice, taking NSAIDs is pretty conservative. If it said like reducing her current running regimen, I would pick that, but it says just continue. Switching to high impact sports probably make it worse. Using a walking boot's probably a little too much, and then increasing calcium intake I don't think it's going to help this. So yeah, I would just do the apply ice, take NSAIDs for this.
Just apply ice, you said?
Yeah, and take NSAIDs. Yeah, I think so.
Wait, say it again. Sorry.
Oh, you can't hear me? Yeah, I think so. I think that's what I would do here.
Okay, gotcha. Yeah, yeah, exactly. Yeah. So rice, right? Rest, ice, compression, elevation, right? So tibial stress syndrome, shin splints, right? So
Okay.
we've all had them at one point in time if you've run. But
Yep.
yeah, you're not going to do anything super, super aggressive, and definitely continue doing the same things. Probably not going to help it, right? Switching
Mm-hmm.
to higher impact sports, definitely not going to help. Using a boot, that's usually for more severe things like fractures and things like that, and then increased calcium intake. Yeah, it helps overall bone, but it doesn't help with shin splints. So the best thing is going to be your rice. So rest, ice, compression, elevation.